Hello, ladies of NAASC. Thank you for your continued support of March of Dimes. We are grateful for this new partnership, and I welcome you to watch this brief presentation that provides a partnership overview, updates about the mission of March of Dimes, and information about how your members can get involved. I'm Erica Perry, the Director of Community Mobilization and Partnerships with March of Dimes, and the National Liaison for our wonderful partnership with your organization. We are so excited about the opportunity to partner with your organization. As a newer partner, we are still establishing some of the ways your members can engage with us. However, I'd like to share some of the ways that we've been working together so far. We hosted a Facebook Live event last September, officially launching our partnership. In November of 2020, your members helped educate the public by sharing information regarding Prematurity Awareness Month via social media and fundraise for the March of Dimes. For the first time ever, your organization will be participating in March for Babies this spring. The partnership between our organizations, it just makes sense. It's a great fit. March of Dimes and the National Alumnae Association of Spelman College, we're working together to end the racial disparities that exist for Black mothers and babies. Our goals: we're focusing on educating and supporting Black women to take care of and advocate for themselves before, during, and after pregnancy to ensure that Black women and their children survive and thrive. Since Spelman College is the largest women's HBCU, it just made sense to work with you all, and we are grateful that we can lean on you to be a voice of change. To the right, you'll see a screenshot of a one-pager that we've created. Use this as a reference to learn more about our partnership. Now let's learn more about the mission of March of Dimes. Our mission: March of Dimes leads the fight for the health of all moms and babies. We imagine a world where every mom and baby is healthy, regardless of wealth, race, or geography. No income level, race, or county should determine if a mom or her baby get to survive pregnancy or the first year of their life. Now more than ever, March of Dimes needs partners in the fight for healthy moms and strong babies. Let's take some time to review some important statistics. The U.S. has the highest maternal death rate among the world's most developed nations. Among other developed nations, the death rate has been stable or falling, but in the U.S., it's getting worse. Every 12 hours, a woman will die from pregnancy-related causes. 2 babies die every hour in the U.S. More than 22,000 babies die in the U.S. before their first birthday. That is 2 babies every hour. Prematurity and low birth weight and related conditions account for more infant deaths than any other single cause, about 1 in 3. Birth defects account for 1 in 5 infant deaths. The U.S. maternal mortality rate has more than doubled. Over 700 women a year die of complications related to pregnancy each year in the United States, and 2/3 of those deaths are preventable. Almost 150,000 babies are born to women living in maternity care deserts, where there is a higher poverty rate and lower household income than in counties with access to care. Taken alone, maternal death and preterm birth rates in the U.S. are alarming. When you factor in race and ethnicity, the story is even more dire. There is a health equity gap in the United States, and moms and babies are at risk. Women of color are up to 50% more likely to experience a preterm birth compared to white women. In the U.S., Black women have a maternal death rate 3 times higher than women of other races or ethnicities. And American Indian and Alaskan Native women experience the second highest rates of pregnancy-related deaths. And if you are a Black mom, your child can face up to 130% higher infant death rate. Each November, during Prematurity Awareness Month, March of Dimes releases a report card. This slide shows the U.S. map with the 2020 report card grades. Last year, we had 8 F states: Alabama, Arkansas, Georgia, Louisiana, Mississippi, Oklahoma, South Carolina, West Virginia, and Puerto Rico. Oklahoma and South Carolina are new F states. There were no A's last year. New Hampshire has the lowest preterm birth rate at 8.2%, and Mississippi has the highest rate at 14.6%. This is nearly an 80% gap between these two states, which points to the disparities that exist across states. The most common state grade was a C+, and 10 states earned that. Even in the United States, access to care remains a real barrier to pregnant women. Without proper prenatal care and quality obstetric services, both moms and babies in the United States will continue to be at risk. 5 million women live in maternity care deserts, counties with no hospitals offering obstetric services and providers, and 150,000 babies are born to women living in these areas. About 10 million women live in counties with limited access to care, which means they have fewer hospitals offering obstetric services and providers, and a high proportion of women don't have health insurance. More than 300,000 babies are born to women living in these areas. We know that preterm birth is expensive for corporate America and for society. The societal cost of preterm birth is $25.2 billion per year. The average cost of a preterm birth in the United States is $65,000. This is a 25% increase in cost since 2005. The work of March of Dimes impacts all moms and babies. Every baby born this year, 4 million, benefit from the work of First Medical Director Virginia Apgar and our more recent work on the importance of folic acid, among other breakthroughs. Through our direct service work in providing continuing education for healthcare professionals and the reach of our supportive pregnancy care work, we're able to reach 700,000 women. We proudly champion and advocate for policies that help improve the lives of both moms and babies, but our work continues. Now that you understand more about our mission, let's discuss how you can support it. There are a number of ways for your members to engage with March of Dimes, and I'd like to share more information about the various ways. Raising funds to support the mission is critical. This year, March for Babies has a bold new vision. After 50 years as the largest fundraiser for March of Dimes, as well as the nation's oldest charitable walk, we pivoted in 2020 to virtualize the event. However, in response to the global pandemic, the shift was in reality the natural evolution of March for Babies to be something bigger. Today, it's more than just a walk. It's March for Babies, a mother of a movement. We need you to join us in being part of a larger movement for change, with unstoppable momentum to make America a more equitable place and to ensure that every mom and baby is healthy. More than just a walk, March for Babies is your entry into making a visible difference in your community now and for generations to come. By joining in this movement, you're lifting up communities for health equity, opening the door for all moms to have access to care, and protecting the health of families by pushing for their rights. Together, let's be a part of something big. Together we can truly make a difference. We can come together with thousands of others to give hope by helping every mom and baby get the best possible start. This can be achieved by raising funds to support families throughout their pregnancy journey. Help us honor motherhood, babies, and families everywhere. So what can you do to prepare for a successful March for Babies team this year? First, make sure you register at www.marchforbabies.org/NAASC. Help spread the word about March for Babies, as we know recruiting fundraising team members is crucial. Do you know someone who's been impacted by March of Dimes? Someone who's a leader in your company or social circle? Or someone who just loves to change lives for the better? We challenge you to invite at least 10 members to join your team. Reach out to the other members of your organization, to your family members, neighbors, and friends. Consider jumpstarting your team by making a personal donation, and then ask others for support and donations. At marchadimes.org, you'll find email templates, Facebook fundraising links, and other tools to help you be successful. You can even consider downloading the March for Babies app. We encourage you to join us and participate. Make sure you tune in to your local March for Babies virtual experience and then go out into your community. Spread the word, exercise, and just have fun. But it's really all about making sure the health of all moms and babies is a priority. I previously mentioned you all have a dedicated link for your organization to use for March for Babies. As a reminder, make sure you register using this link. Here's a screenshot of your page, and know that you can track your organization's fundraising total, your top chapter teams, as well as top fundraisers. While we encourage online fundraising, please note that you can mail in checks, but make sure you include the offline donation form specific to your organization in the mailer. To show our thanks, we would like to unveil our new loyalty program. There will be special recognition and thanks at both the local and national level, as well as certain items that will be sent out, all based on individual fundraising levels achieved. For more details, please visit marchforbabies.org. Along with our loyalty program, you can showcase your support by downloading a fundraising badge from your personal fundraising page. As an individual fundraiser, you'll receive a t-shirt once you achieve the $100 level. You can customize your own yard sign at the $250 level, and you automatically join the Circle of Champions and receive a fun walk in the box at the $1,000 level. Some of the fun items included in the box that can be used to celebrate your own personal walk are masks, superhero capes, finish line banner, pom-poms, balloons, and more. You'll also be recognized at the National Virtual Awards Celebration on July 22nd. All of us have been personally affected by March and I's mission to fight for the health of all moms and babies. You may have had or know a baby who was born preterm or with a birth defect. There may be a mom in your life who's suffered a loss or a pregnancy complication. Or perhaps you're grateful for your healthy family. Your connection to the cause will keep you motivated to empower families. At marchforbabies.org, you'll find great resources like sample emails, social sharing tools, fundraising tips, and inspiring stories to help recruit supporters and boost your fundraising. In the FAQ section, you'll find instructions on how to link your Facebook fundraiser to your fundraising page to receive credit for what you have raised. The tips and tools provided on marchforbabies.org make it fast and easy, and they significantly impact your team's success. In addition to March for Babies, we are excited to give our supporters an opportunity to fundraise your way. You can sign up on our DIY platform, and it allows individuals to create their own fundraising campaigns whenever they want, connecting with us in a manner that is meaningful to them by unlocking unlimited fundraising potential and propelling our mission forward. Starting a fundraiser is relatively simple. Visit www.marchdimes.org/DIY and choose a box that best suits your interest. If you need additional assistance, we have created several tools and resources, such as a quick start guide, know your network, poster templates, and social media assets that are all posted on the site. There's even an instructional video available to walk you through how to sign up as well. In addition to fundraising, your members can consider a variety of ways to volunteer with March of Dimes. Volunteers drive our work to empower families. With help from people like you, we're making an impact through education, research, and advocacy, but there is still work to do. Join us to mobilize your network and find general volunteer activities at getinvolved.marchofdimes.org. We also have leadership opportunities available. If you're passionate about helping moms and babies and are willing to bring along your skills, talents, and network, there may be a position for you. Consider filling out the online interest form, and we'll pair you with your local March Dimes staff to review market needs related to market boards and event committees. On our website, getinvolved.marchofdimes.org, you can see a list of different volunteer activities. Find opportunities like writing notes of hope, assembling personal care kits, or organizing gratitude gifts for healthcare providers. We also want to encourage you to be an advocate for moms and babies. On this slide, you'll see March of Dimes priorities: increase access to quality health care, support healthy women and babies, improve research and surveillance, protect moms and babies during COVID-19 public health emergency. We invite you to join our advocacy network and encourage others to do so as well. When you join, you'll receive our action alerts and be the first to get information on our legislative efforts and how you can make an impact on the health of all moms and babies. None of us could have anticipated the year that 2020 would become. COVID-19 turned our lives upside down, but that didn't stop us from fighting for the health of all families. Throughout all the challenges, we still brought people together. We focused on critical issues facing moms and babies and worked to make our country a more equitable place. We want to thank all of our supporters that helped make these accomplishments possible. Although we've made tremendous progress, there's still so much work to be done. With preterm birth rates continuing to rise, the U.S. remains among the most dangerous developed nations for childbirth, especially for women and babies of color. This visual also highlights some of the additional ways that our supporters were able to help us make a difference for moms and babies last year. As a recap, there are a variety of ways you can support March of Dimes. We want to encourage you to participate in March for Babies or start your own fundraiser on our DIY website. You can volunteer your time by searching the different volunteer opportunities available at www.getinvolved.marchofdimes.org. And consider joining our advocacy network by using the special link specific to your organization. For additional information and assistance, please reach out to your national liaison, Kim Williams, or feel free to contact me, Erica Perry. I encourage you to go share the importance of the work that we are doing for families. And thank you for being an invaluable part of this community. Please continue to join us in the fight for the health of all moms and babies.